to SBConnect, where we are transforming lives by connecting to and educating for the world of work. Today's session is by the UCR School of Medicine, discussing careers in forensic science. Today, we have the wonderful Roseanne Rosenthal, who will talk to you about the intersection of criminology and health science and her expertise in the field of forensics. So without any further ado, Roseanne, have a wonderful session and welcome to SBConnect.
Thank you, Dr. Richards. I'm very excited to talk to you all today. This is wonderful. I'm so glad. And I think we're all getting pretty close to summer break, so that's kind of exciting. I just wanted to kind of give you a background of who I am and what my job has been in the past. I'm actually a forensic nurse. I'm also a certified crime scene investigator. And I became certified through the University of California Extension Center. It is a great program, and I will be going over kind of how it's structured for you, letting you know that you don't necessarily need higher education to get into the Extension Center. It is geared to individuals who don't necessarily want to go to a higher education, but still want to get into the crime scene environment and careers. So let me go ahead and start with my presentation to kind of give you a little bit of my journey on how I started. Prior to opening up my presentation, I'd like to tell you that I am a practicing nurse, but was a practicing nurse at the time that I started. I didn't know a lot about forensic nursing. I happened to come across a catalog that spoke to forensic photography and didn't know a lot about it. So I inquired and found out that as forensic nurses, there's so much diversity in the forensics fields. So I will go ahead and start my presentation. Welcome to the world of forensics. I will go ahead and explain exactly what that is. I'm a little bit more familiar with forensic nursing since that's exactly what I did and do. And so I will go ahead and explain or give you the definition of forensics. So the definition of forensics is forensic science is an application of science to the criminal and civil laws that are enforced by police agencies in a criminal justice system. This does not exclude or just is exclusive to police agencies. There are also other jobs and professions that fall into this category that I will go over with you in just a second. There's a lot of diversity of the practicing professions within forensic science as listed by the American Academy of Forensic Science, the largest forensic science organization in the world. There's criminalistics, there's engineering science. So engineering science is basically what they look at is when there's a crime scene, they look to see how, the sidewalk was at the time, was there types of defects that were in the sidewalks, and they look at all the construction around a crime scene. So there's general, just jurisprudence, ontology, which is actually looking at the teeth of forensics. So for instance, if we have a victim of a crime and they have a bite mark, we will take an impression of the bite mark and try and match it to someone that, that's a potential perpetrator. Pathology and biology is basically we look at, and that falls under autopsy. These are physicians that actually look at, that do the autopsy to see mode and method of death. Biology would take into account like such things as DNA, And they will look into what's going on in the blood, where's there drugs, where's there alcohol. These are the kind of things that fall under their scope of practice. Physical anthropology, this is kind of close to my heart because I'm in an anthropology, medical anthropology program. Physical anthropology basically looks at more of bones, not necessarily bodies that have flesh still on them. Typical physical anthropology would be like a airplane crash where they go and they recover remains. Psychiatry and behavioral science is basically psychiatrists or psychologists that look at the behaviors of perpetrators. They look at the, what was going on as they were children. This is more geared to people who are always continually doing these things in society. Question documents, there's people that actually look at documents, things that are written, pieces of paper they might find. For instance, there was a manifesto that they would look at. Toxicology, again, would be something looking at specifically only just alcoholism or alcohol consumption or drugs. There is a new profession to this group, which is a nurse investigator. Much like a coroner, this nurse investigator would take control of the crime scene, make sure that they recover the body, and then they're going to be the ones that actually perform the autopsy. So the list of professions is not exclusive. The prior one that I showed you, there's a lot of people in there that have an MD or PhD and that type, or RN that was included in that one, in that last slide. However, there's a lot of other professions such as fingerprint examination. These individuals are typically just looking at fingerprints. They examine and they analyze the fingerprints that are found at the crime scene, and they match them to someone that might be the perpetrator. Firearm and tool mark examination. These are the people that will fire the firearm that they found at the scene to see if it matches the bullets that they recovered. Computer and digital data analysis. These people actually look at computers. For instance, a perpetrator might have something on their computer and they try to erase it. These people, these individuals actually can go and recover all of this information. Photography, we have forensic photographers that actually go and take pictures of certain crime scenes, and I'll show you in just a second what that looks like. And of course, something that's dear to my heart, which is forensic nursing. When I went into the crime scene investigation, and it's called the CSI Academy, we had to do certain, perform certain tasks as part of our final. In this photograph, you can see here, we actually did a laser. So we were looking at the trajectory of a bullet. We knew basically where the bullet landed. And so we would going backwards, we would try and see where the bullet would have started, the initiation of the bullet. So we used a laser and took pictures of that. This is very difficult to do because you got to get, the camera at the right angle, not only that, but at the right speed, at the right time, so that you can actually see that laser going across, and then you can actually document that. Kind of fun stuff. Not only do we do photography, but we have to actually do diagrams and we have to do a layout. It's in addition to photographs and documentation of, any other type of documentation. We actually have to lay out how the body was found. Again, this was a crime scene that we did for our final. It was laid out. It was not a real crime scene. It was just a makeshift one. The person we have there was actually a mannequin. And we had to document by drawing. And in this case, it was actually a program we used. And we placed all the furniture in there just to get a better idea, bird's eye view, and a different perspective of what actually happened here. I don't know if most of you know or have ever seen the show Crime Scene Investigation. It was great. And I think there's maybe one that's still on. And so a lot of people, when this show came out, it really attracted a lot of people to this profession, which was great because we needed more people that were in this profession. Just a couple of pictures that I took with some of the actors that were doing this. They were kind of excited about meeting a real CSI. So that was kind of fun. When I went through the CSI Academy, this part was actually blood spatter. And so what we did is, learning how to actually document blood spatter. We would use different tools. Again, it was, actually it was animal blood that we used so that we can actually see the spatter. We can see, if it was arterial, if it was, spray, and how that all works. So an overview of forensic nurse is relatively, it's a new practice. We have not had a lot of forensic nurses that have, that actually have started. Usually forensic nurses, they treat the victims of violent crimes, they perform crime scene investigations or work as detectives in a clinical setting to help police catch and convict perpetrators. So one of the most important duties in forensic nursing is assisting in physical and emotional recovery of patients while protecting their rights. And this specifically is, most specifically in this area, is for survivors of rape. And that's what a forensic nurse usually is the only one that takes care of the survivor in these cases at the emergency room. So again, most of them are the ones that take care of sexual assault individuals. It's called SANE out here. They perform collection of evidence, and they also cater to the emotional needs of the individual. The evidence is extremely time sensitive and needs to be collected within 72-hour window. And that is because you don't want that evidence to degrade by then. But it has to be handled in a certain way, because once it goes to court, they need to know that nothing was ever tampered with. So forensic nurses are trained to recognize, collect, and preserve evidence while treating the patient. We also look at the wounds, and we take pictures of the different wounds that we find, bruises. If we have to take them to X-ray, we make sure that those X-rays are included, and we take care of them with that. This also happens in correctional nursing. We do have victims that come in from the prison system that we must take care of. Gerontology basically is someone who's older, and if they are victims of crimes, we take care of them too. There's a nurse coroner, death investigation. Of course, it's just like a coroner, same thing as you've seen before. Legal nurse consulting is someone who actually goes in and looks at documents in the court system to give, consultation whether this would really actually happen or not. Community education, we actually go out to the community and start talking to them about safety. How do you keep yourself safe from perpetrators, and especially children? We talk to them a lot on how to remain safe. So to begin working in forensic nursing, you do need a degree in nursing. Most nursing schools with forensic nursing degree programs offer a 2-year graduate level course, and they award you a Master of Science in Nursing. Working with as a SANE nurse requires additional specialized credentials, such as the one in the Extension Center that I just told you about. We do address public health, and that's a big component of our jobs, and biological environmental threats to the health and safety of the community. And what we're talking about, that is not only just, things that happen as far as, we talk about gunshot wounds or, gun safety and how to remain safe in those areas. As you know, a lot of conversation has come just lately about safety within the schools and mass shooters. We talked to them about that and how to keep our students safe. The nurse coroner, as I mentioned before, they do death investigations, and they are the ones that recover the body at the scene. Usually these types of nurses are in larger areas, not so much in the smaller agencies, police agencies that are out in rural areas. For the function of nurse coroner, again, they work closely with a variety of governmental agencies, including law enforcement, organ and tissue procurement agencies, which means that if the victim actually has a card that says, I want my organs to go somewhere, they also will be able to facilitate that. So your qualifications, again, is that you need a degree in nursing, and also the extra training that you would have through programs such as the Extension Center at UCR. The investigator does a lot of the same things as detectives. They also work closely with detectives to make sure that they, are able to recover not only remains, but also anything such as blood. Make sure that they have something like if you have a glass and they might see that there's fingerprints on there, they will recover those as well and take them back to the lab. Responsibility for forensic nurse investigator includes responding to a scene, collaborating with detectives, examining the body, taking blood and tissue samples, photographing the body at the scene itself, keeping records, and arranging for the body to be taken to the morgue for autopsy. They help with autopsies and work side by side with the forensic pathologists in collecting evidence. It is going a little bit further now where nurse pathologists, nurse investigators will actually be the ones that are performing the autopsy instead of a coroner to help out with the mass amount of people that we need to get through. Forensic nurse salaries are pretty good. They can earn as much as $75 per hour and up to $300. So FBI nursing careers, we are also in that environment as well. We perform basically the same things that we do in the local agencies and just at the federal level. And so for more information, here is the website to the Extension Center. And I think that maybe Dr. Richards may be able to give this to you should you not be able to see it at this moment. And that's it. If you have any questions that you would like to ask.
Yes, now we're in our Q&A session where we would like to ask our participants to go ahead to your chat, put it in the chat room, and I will go ahead and ask Ms. Roseanne your question. First question. What was your most memorable crime scene as a forensic nurse?
Well, in Southern California, we have not really started going into crime scenes. Most of our work is responding to rape victims. At this point, they're just going out towards the police agencies or the law agencies because we had so many law enforcement that would take over that those scenes. We were basically just doing rape victims at this time.
Our next question, do forensic nurses go through law enforcement training?
They can in the case of FBI. They most definitely would have to go through that. So it would be a little bit different. As far as the local agencies, no, we do not have to go through that.
Okay, our next question, what does the typical work day or work week look like for forensic nurses?
It varies. Most of us we hold other jobs other than our forensic jobs. Usually we work in the emergency room because that's usually when we will be called into a victim's room. And so most of our jobs are the emergency room where we can be utilized in different ways, and we can then assist a victim from that point on.
Wonderful, wonderful. Again, I'm looking for your questions in the chat room. We have another question coming in. What is the demand locally for careers in forensics?
As far as in general or nursing?
Well, in nursing, I believe is what the question is referring to, and locally in the Inland Empire as well.
There's a big need right now, especially with what happened during our COVID. We lost a lot of nurses. A lot of them retired. So there is a big need. There's always a need for forensic nurses because, it is a specialty area, and it takes a bit of training, also to deal with the psychological impact that victims and their families have. So it's very, very necessary and important.
Wonderful, wonderful. Next question. Do you have any reading material you would recommend on forensic nursing?
I don't think that there's a lot. You can actually, I would use Google Scholar to research that. There might be some there. Also, the programs that we have locally, you can reach out to them and they might have some literature for you to look at.
Another question, a student wants to know, how can you tell the different ways someone has been killed by the different blood splatter patterns?
You look for arterial, which is the artery. You can look at blunt force trauma by the way it sprays. So there's a lot of different ways that you can see and you can tell. You can actually look at exactly where the victim was sitting or lying just by the angle. There's a lot of physics involved in analyzing that. So if you don't like physics, or if you do, it's great too. But yeah, there's a lot of physics involved in that, and there's a lot of different ways. But you have to go through a training to find out. It's really exciting. It's very interesting.
And since you highlighted a need to have a good grasp of physics, what other subject matter skills or abilities would someone need to begin to hone in on as a middle school or high school student who is considering a career in this field?
Well, physics is definitely one, especially if you want to go into to analyze blood spatter, which is, again, fascinating. Another one is biology. If you want to go into basically when you go into toxicology, or if you just want to be an assistant to the coroner, biology would be great. Anything like that. Also chemistry. Chemistry would be taken into account when you're looking at toxicology. If someone has consumed, you want to see what the blood alcohol is, or if they've taken some sort of drugs, you can test the blood for that. So that would be great too. That would be a great help for anyone that wants to go into that.
Okay, we have a question from Miss Adams' class. How are you able to find evidence when it's deleted from the phone?
I'm not an expert at that, but that would fall under that computer information group or individuals. They're the ones that are trained for that, but they do go to the phone companies, and some of it will be there stored at the phone companies, but they do have a way, they have programs that can actually extract all that information right off the phone.
So can you talk a little bit about your expertise and what drew you to the field of forensics?
Well, what drew me, it was kind of a fluke. I just happened to, I really didn't know much about forensic nursing. It was relatively new, right? There wasn't a lot of, that profession really wasn't out there. It wasn't advertised as much because there really wasn't a lot and not a lot of information. I just happened to be looking at a catalog from UCR Extension Center, and I happened to look through, they had a nursing category in there, and it was basically advertising, or in the catalog, it was listed as forensic photography. I'm kind of have a little love for photography. So I decided to take the class and found out that there was a whole certification, program for that. And so I was like, this is great. And what happened was, how I got into crime scene investigation was I had to do an elective, much like you do at school. And so I took autopsy, and I found out that that was part of the CSI program that had, talking about finger prints and blood spatter and all that. So I ended up enrolling in the CSI Academy that was during the summer. And that's when we learned how to do footprint casting, also tire casting, and all of that. It was very, very interesting. But again, I kind of fell into it. My expertise was mostly in responding to survivors of rape and dealing with them and their families. So that's basically collection of evidence and just trying to help them get through the event.
Okay, we have another question. How has your job impacted your mental health?
Well, I would say it's not any different than working in the emergency room. I worked 10 years in a trauma center, and we still see those types of injuries. However, when it comes to survivors of rape, they tend to be older. In the emergency room, we see all ages, including infants. So it's very difficult. There's, more of a variety of injuries that we see, and what happens and how it happens. For instance, there's car accidents and things like that. So we kind of use the same method of self-care that all nurses need to do. And, we do have to do a lot of self-care just to maintain good mental health.
Wonderful, wonderful. I think we're going to take two more questions. How long does it take to become an FN?
A forensic nurse?
Yes.
Well, you first have to get your nursing degree. So you have to get your RN. And then after that, I believe it's about 18 months to get your forensics certification.
Wonderful. And can you speak to how well UCR are preparing candidates for interest into occupations in forensics?
UCR Extension Center is excellent. We have a lot of people that come from all over to enroll in this program. It's very well accepted in the local agencies. They know that there's people that are produced from that program that are very well trained. So I highly recommend it. It is going to be completely, you're going to be very well rounded if you go through that program, most definitely.
Okay, Roseanne, what final message do you want to leave with students on this chat and those that are going to be watching it afterwards, considering a career in the field of forensic science?
If you have any interest, I would look into it first, get all the information that you can to find out if that's something that you want to invest in as far as time. I would talk to people that are already in the field, and, just they would be more than happy to talk to you, and just kind of, you know, approach them and say, can I take a moment of your time and just get a feel for what their life is like, right? In any area that you're at. And ask them questions. There's a lot of, people that are, and especially for the instructors that are in the audience now, reach out to the agencies and ask them to come and do a talk in your classrooms. And that will give the students an opportunity to talk to someone in the field one-on-one, which would be great. And I think you would really like that. So they've got a lot of great information, a lot of experience that would really help you.
Wonderful. Well, Roseanne, thank you for such a credible session today on forensic science. We look forward to you returning to SB Connect soon. Educators and students, thank you so much for participating. Educators, before you leave, make sure you go to sbcalliance.org where you can see our next session. And don't forget to take that survey. We want to know what you think about today's session and how we're meeting your needs. Again, thank you for participating in today's SB Connect session, and have a wonderful summer.